to the CHPs and see that tumetimiza ile maneno tumekuwa tukiongea hapo kwa Ministry of Health. But before that, I want to recognize my colleague from the Ministry of Health, Harry Kimutai. Sijui kama unataka kusimama hapa watu wakuone. Ulianzana na CHPs, but because this is a promotive function, it had to come to the State Department of Public Health. And therefore, at this juncture, Your Excellency, I want to invite Anthony Gitao, the representative from Johnson & Johnson, just to say hello.
Thank you, Madam PS. I stand here on behalf of Johnson & Johnson, Your Excellency, the Deputy President, my friend, the CS, Ministry of Health, the PSS. We are really grateful for this moment. And all the CHPs, afya yetu. This is a dream come true, Your Excellency. I stand on behalf of Johnson & Johnson and all the partners of the community health units for UHC, which has been a convening of all partners working under the Division of Community Health to come together to really make sure we can have community health workers who are kitted, who are resourced, and who are paid. And last year, Your Excellency, mulitupeleka mbio sana. You took us through kit launch very quickly. We launched the CHPs in October, and now we are launching the pay. We are very proud. It's a dream come true. And on behalf of our chairman, who was not here today, and all the CHPs, I'm sure, would want to say that that will really deliver on the promise that you have. During the launch of the kits, I remember one CHP, I told them, now you will work very well. And they said, imagine we were working for free. Imagine now that we are paid what we are going to do. And that's what we look forward to. So thank you very much.
Thank you. Thank you very much. I wish to invite Dr. Ndirangu from AMREF to come and say a word.
Your Excellency, the Deputy President of the Republic of Kenya, Geoffrey Rigathi Gachagua, Honorable Cabinet Secretary, Susana Kumisha, Bona PS, Harry Kimutai, and Madam PS, development partners who are here, Dr. Diaro from WHO, Shaheen from UNICEF, and my friend Gitau has just spoken. AMREF South Africa is very delighted to join this event today. And allow me to start by congratulating and thanking the community health promoters who have joined us for this event. Please let's clap for all of them. I want to congratulate Kenya and thank the government because we know we have more than 100,000 community health workers who are now fully kitted. And what is happening today is to ensure that they are facilitated with stipends. And the ones who have come here are representing all the 100,000 who could not make it. So on that first note, I truly want to thank the government of Kenya for the leadership. Number two, I want to thank the government and the development partners and the people of Kenya because of taking a bold move to create the legislation, the governance, the legislation needed to drive primary health care across the entire nation. The 4 UHC laws, once again, congratulations. Thank you very much, Madam CS and Deputy President, because we really needed those laws, and we are confident that the issues around them will soon be all resolved. And finally, I truly want to thank the government and the people of Kenya for demonstrating commitment. People talk of political commitment, but in AMREF, we talk of political commitment and action. By kitting the 100,000 community health promoters and allocating the stipends, people put money where their mouths are. The things we care about, if we care about prevention, we'll put money there. Once again, congratulations and thanks to the national government for allocating the stipends that these community health promoters need to do their work. Thank you for the opportunity to speak, and you have a commitment of AMREF along this journey. Thank you.
Thank you so much. Peter Ndegwa, CEO Safaricom. This CEO ensured that we have the 100,000 phones that are being used by the CHPs. A round of applause for Peter Ndegwa, CEO Safaricom.
Thank you. Your Excellency, the Deputy President of the Republic of Kenya, I want to say, because of time, all protocols observed, all my colleagues who are present, but I want to recognize the CHPs. Afya yetu, you are the heroes of this program. We are very delighted, Your Excellency. Let's clap for CHPs, please. So without this great team of 100,000, who we have all given all the funds that were required to be provided to the CHPs, they are all with them. Without them, we cannot have the data that we need. We cannot have the visits that happen to each household. The 10 million households that will be visited will happen because of the CHPs. So they are the heroes of today. Ours from Safaricom is to commit to support CS, Madam CS and her ministry in supporting the whole program, starting with this program, but also beyond that. In addition, I'm sure you are going to start receiving stipends. We operate M-Pesa. I'm sure some of the stipends will be received through M-Pesa. Yeah. So I'm looking forward to making sure that you get all the support that you need. But more importantly, going forward, Your Excellency and Madam CS, Safaricom is here to support the healthcare program. We are committed to it, and we'll make sure in the future we continue to be involved. Thank you very much.
Thank you so much. Okay. Thank you so much. Your Excellency, when I joined the Ministry of Health, every other memo that would come to my desk, every director would ask, please speak to Dr. Diallo. Please speak to WHO. And I kept asking, what's so big about Dr. Diallo? But having stayed there for 6-7 months now, I understand that WHO is a partner to rely on. Dr. Diallo, this event will not go before you say a word. I'm inviting you to the podium to say hi to your CHPs. A round of applause for Dr. Diallo, country representative for World Health Organization.
Thank you. Your Excellency, Deputy President of the Republic of Kenya, the Cabinet Secretary for Health, my sister Susan Nakumicha, PS Mari Mtoni, PS Ahari Kimtai, colleagues from the Ministry of Health, development partners, and more importantly, community health promoters, good afternoon. It is a real pleasure for me to be here and a real honor to witness payment of stipends to community health promoters. Your Excellency, Kenya has marked a huge milestone today by providing stipend to practicing community health promoters. I would like to extend on my behalf, on behalf of WHO, on behalf of, I'm looking at my sister Shaheen from UNICEF here. We do everything together. The UN agencies working in health. I would like to extend sincere, heartfelt congratulations to Kenya through the Ministry of Health for the bold decision made to embark in achieving universal health coverage for the people of Kenya. Your Excellency, we witnessed the journey that Kenya embarked in through adopting primary healthcare network approach and recruiting, training, commissioning community health promoters. From Alma Ata to Astana, it is very clear that achieving universal health coverage goes through primary health care, specifically community health system, and in this case, through community health promoters. Your Excellency, the community health promoters, before they were recruited, trained, a package of service was defined, their profile was defined, they were trained and equipped with what they need, deployed, and the step taken today makes a huge difference in ensuring sustainability of this initiative. So once again, we would like to congratulate Kenya for taking this important step and reassure you of our firm commitment to stand by your side as you go through this journey. Congratulations and thank you.
I want to recognize the presence of my sister, Shaheen from UNICEF. Please say hello. You have contributed a lot to this cause, and we know where you have kept us in your heart. Thank you very much. At this juncture, I would like to introduce KCB CEO to just say hello.
Thank you, PS. Your Excellency, the Deputy President, all protocols observed. I'll try and beat Peter's record on time. We are truly grateful to be here. Your Excellency, you know, from the point of Inchiako, Benkiako to today, for people for better, KCB has always been there to partner with ourselves to take this country forward. You can stand committed and you can be assured that KCB will be there to make sure not only that CHPs are paid on time, but that we enable them beyond just the role they do. So I thank you.
And you'll do just that in a few minutes. Your Excellency, I learned about community health volunteers when I was a very young girl. My late sister was a community health worker. And our small household used to be like a small clinic. I saw it happen when I was growing up, that anybody who would cut themselves in their farm with a panga, they would come to our home, she would clean their wound, and she would advise them to go to hospital for tetanus injection. Any child who would get sick at night, may it be fever or anything, people would knock at our door even at 3 a.m. in the morning, and she would sort them. Any person, any elderly person who would not be able to make it to the clinic in good time should be able to tell them whether the blood pressure was high or what was happening. This is like a reinvention of what used to happen. And we are so happy because these community health promoters will cater just that. That is at our households. You'll be able to move from house to house and ensure that nobody has a challenge. Kama ni wale wa mama wenye wamepata watoto, go and remind them that their children need to be vaccinated. Kama ni vaccination ya polio, lazima imalizwe, si ndio? Kama yes, kama ni mtu mwenye amegonjeka ile magonjwa ya long term kama AIDS, uambie lazima wakunywe dawa, si ndio? Kama ni mambo ya kupanda miti kama venye rais ametuambia, so that our environment can be good and clean, tuwakumbushe. Na pia tutaendelea, we will continue refilling your kits so that your work becomes easy. Therefore, Your Excellency, at this juncture, I would like to invite the chair of the National Assembly Committee for Health, because without him, we will not get money to pay these CHPs. Sisi tunakaa chini na Bwana Pukose, tunamwambia kwa nini tunafaa kuwalipa. Na yeye akienda bunge anapitisha, inaenda treasury, tunarudishwa pesa, tunawalipa. Sio ni kitu mzuri? A round of applause for our national chair.
Your Excellency, our Deputy President, Rigathi Gachagua, our development partners, Cabinet Secretary, PSS, and CHPs, amjambo. Afya yetu, jukumu letu. Please allow me, Your Excellency, to introduce my colleagues. I'm accompanied by my Vice Chair, Honorable Patrick Ndwiga Munene, member for Chuka Ikampangombe, Honorable Cynthia Muge, County Women for Nandi. Your Excellency, I want to say that serikali yako na William Ruto ni ya kusema na kutenda. And for CHPs wherever you are all over this country, hii ndio serikali ya kuamini. Because wakati you've been there as community health volunteers, but nobody has ever thought that you should be given something for what you've been doing. It is only this government of Kenya Kwanza that has thought and taken time to support the activities that you are doing. So wakati unapotembea unajua serikali hii ni serikali ya kusema na kutenda. Si ndio? Unasema ingine 20 fresh. Asante. Secondly, you know, even with delays by the county governments, hii serikali imesema tuanze kuwalipa. And I want to urge the governors wherever they are, please, as the national government is paying, hata nyinyi pia muanze kulipa our community health promoters. But I have one appeal to you. We need to link up. When we are saying we are offering primary health care, we need to link up with nutritionists, with public health officers, so that we make sure that we have a seamless primary health care support service at that level, that we work seamlessly with each other. Mutafanya hivyo? Mungu awabariki, asanteni sana.
Thank you. Thank you very much, our chair. And I want to assure you, these community health promoters, they've already been doing a lot in the community. Na je tukiwapea stipend? Si kazi tutanyorosha kabisa. Kabisa kabisa. Are we ready to support even at least one day in a month for public health activities? Are we ready? Tuko tayari? Tuwalete mpaka vifagio huko kwa ground. Your Excellency, we have a great team to help us transition from curative to preventive and promotive health. And with this team, and with our referral system, and because my boss is here, I know she'll talk about it, we have a good model to ensure that the health of this country, even the planning, is gonna be better. That more money can go to the right places. Tutajikinga kutoka nyumbani, manyumbani zetu, so that we don't keep queuing at the hospitals because of flu, mambo ya kuumwa na tumbo juu umekula nyama imeanguka na huko ya punda, mambo ya kunywa maji sio safi. So we teach our community on how to remain healthy. At this juncture, I wish to introduce to you all somebody that you know. Maybe you have met her, maybe you've seen her in the television. Mama wa kazi. Mama wa kazi, si ndio? Your Excellency, I want to tell you, I am working with a very hardworking boss, that she keeps me on toes. She'll ask me even the minutest of the things to make sure that things are okay. Before we came here, she was still on my phone. Have we done this? Have we done this? She knows what we need to do. Ladies and gentlemen, I want you to put together your hands for my CS, Madam Susan Nakomicha.
Asante sana. Your Excellency, the Deputy President of the Republic of Kenya, Honorable Rigathi Gachagua, the truthful man. Our chair in the National Assembly for the Health Committee, Honorable Dr. Robert Pukose, together with the honorable members who have joined you today, our development partners, WHO, UNICEF, Johnson & Johnson, AMREF, KCB, Safaricom, and all the rest who I may not recognize where you are seated. My colleagues, beginning with my two very hardworking individuals, PS for Medical Services, Harry Kimtai, and PS for Public Health and Professional Standards, Mary Muthoni Muriuki, my colleagues from the ministry, who work extremely hard as well, and our army, the army of the Ministry of Health. Watu wale, mnaambia watu wafanye fujo waone, si ndio? Community health promoters, good afternoon. God is good all the time. Asante sana. Your Excellency Deputy President, today I am filled with great joy and immense pride that this day has come, that we are launching and commissioning the payment of stipends to our community health promoters. I could never be happy than I am today. Your Excellency, community health promoters are the backbone of primary health care. Everything that we do in primary health care is hinged on these people that you see seated here today. They work tirelessly to ensure that we are preventing diseases. They work tirelessly to ensure that we are promoting good health. They work tirelessly to provide essential services at the community level. And they also work tirelessly as a bridge for the community to the health facilities. There is no better way to appreciate them than the small stipends that we are going to launch today. Your Excellency, you did move around the country together with His Excellency the President, and you promised that we are going to achieve universal health coverage. And for countries that have gone ahead of us to achieve universal health coverage, they have built their health on the strong and firm foundation of community health services. And it is said, it is foolish for you to know the right thing to do and not to do it. So we recognize at the Ministry of Health that the only way we can achieve universal health coverage is to have a firm foundation in community health services. And that's why today, liwe liwalo, these are my people, Your Excellency. we did promise them kits. Tuliwapa ama hatukuwapa? Muko na kits? Muko nazo? Your Excellency, we promised them that we are going to give them gadgets. Simu. Na si simu ya hivi hivi. Si ya kufinya finya kuchosha vidole. Simu ya kisasa. Tuliwapa ama hatukuwapa? Yes, ndio wanasema yuko mpaka na cover. Na kuna kitu moja hamjui. Hizo simu zenyu ni muhimu sana kwangu, mpaka nimezichukulia insurance. Ndio mjue ya kwamba hizo simu ni muhimu sana. So Your Excellency, tumekuwa tukitembea na kila mahali wanasema ilikuwa imebaki kitu moja. Ilikuwa imebaki nini? Stipend. Si ndio? Do tu ndio ilikuwa imebaki. Sasa leo ndio ile siku. Your Excellency, and we would not have gotten a better chief guest than the truthful man. Mtu hakikisha ya kwamba tuliweka ahadi na tunatimiza. I'm really happy that you managed to join us today, despite your busy schedule. You've just come all the way from Nyeri to officiate this function. I'm really honored, Your Excellency, that you found time to come and join us. To the CHPs. Sasa mmesikia nyinyi ni jeshi. Nimewapatia risasi. Mko nayo. Na sasa tunaongezea kitu. Sasa mkikosa kufanya kazi, itakuwa namna gani? Kazi mtafanya, hamtafanya? Mtafanya? Excellency, umesikia hao wamesema watafanya kazi. Na nataka mjue, mimi nikiwa kwa ofisi yangu, ile kazi mnafanya ninaiona. Screen kubwa kama hii niko nayo kwa ofisi yangu. Ukiweka data, ukiingia kwa nyumba, mimi naona ya kwamba umeweka. Sasa wewe fanya kazi kwa bidii. Siku moja utastukia tu nimekupigia simu kukuambia hongera zaidi ya vile unafanya. Your Excellency, what we are doing today looks small. It even sounds small, but I can assure you that it's an investment that we are making. And what I know, this investment is going to come back to us in terms of a very healthy nation. And if we have a healthy nation, then we equally know that they are going to participate in economic activities. There are many professionals who have been wondering why the ministry is so focused on these community health promoters. But I want to assure the country, to also assure other health providers, that as a ministry, we have fixed the best, it is done. That is level 1, we are done with it. Now we are working together with the counties to ensure that then we go to level 2, level 3, tukipanda kuendelea juu. And Your Excellency, you will speak about it, about the programs that we have to ensure that now, even as Kenyans leave the community and go into health facilities, they find facilities that are ready to provide services. Mine is to assure the country what we have here is just but a fraction, Your Excellency. Initially, we had 100,000 community health promoters, but with the request of governors, based on the numbers that they had in the field, now we have a total of 107,000. And Your Excellency, I want to thank you, together with the President, for focusing that you have given me a budget to ensure that we take care of the 107,000 CHPs. So when we begin today, ni kuenda. si ndio? Hakuna kusimama. Rais na naibu wa rais wametupatia pesa. Sisi tuhakikisha ya kwamba kila wakati mnapata. And now today that I have my partners here, I have a small request. Because we are working very closely with the KCB Bank and Safaricom. This stipend, if we subject it to the usual cost of a transaction, we will affect what we'll get to these people. Sasa, I'm on my knees. Safaricom and KCB. Simu wave tu hiyo yenye huwa mnalipisha. Ndio waipate kama iko sawa ama namna gani? Na nimeona Peter Ndegwa amesmile. Nimeona Paul Russo amesmile. So I take it that wamekubali pesa yenu itafika ikiwa full. Sasa vile nimepata hiyo, mimi sina kitu kingine ya kuuliza. Mimi ni kufanya kazi pamoja na ma-PSs wangu, kufanya ile kazi ambayo umetupatia, na niwashukuru sana. Kwa hayo mengi, ningependa tusimame. Na nataka muweke mikono pamoja, msugue. Sugua, sugua, sugua. Sugua, sugua, sugua. Paka usikie imekuwa moto. Haya, rembesha juu namna hii, namna hii, namna hii, namna hii, rembesha, rembesha, rembesha. Mwagia naibu wa rais. Tengeneza ingine, tengeneza, tengeneza, tengeneza. Weka makofi.
Thank you. Please be seated. Please be seated. Thank you, CS Susanna Kumisha. Our Cabinet Secretary for Health, Susanna Kumisha. The Principal Secretary, State Department for Public Health and Professional Standards, Mary Mudhoni Muriuki. Our Principal Secretary for the State Department of Medical Services, Harry Kimtai. Our development partners, Johnson & Johnson, AMREF, KCB, Safaricom, WHO, UNICEF, and all the others. And most importantly, the great army, our community health promoters, distinguished guests, good evening. God is good. All the time. And all the time. God is good, and that is nature. Wow. Salimieni kwa hewa. Bwana Yesu asifiwe. Amen. Bwana Yesu asifiwe tena. Amen. Jeshi ya Nakumisha, Happy New Year. Happy New Year. Afya yetu. Afya yetu. Na jukumu letu. Happy Valentine. Happy Valentine. Asanteni sana, na let me take this opportunity to welcome you to the Hustlers Mansion this afternoon for this very important occasion. Today, we make a key milestone in our health sector as we launch payment of more than 3 billion Kenya shillings stipend to the 107,000 community health promoters. As the national government, we are honoring our commitment of contributing 50% of the stipend to these great men and women. For the last 4 months, they have selflessly served our nation. On behalf of our President, Dr. William Ruto, we honor you for your vigor and valor, which is changing service delivery to the people of Kenya. These are undoubtedly our health heroes. Pongezi, asanteni sana. I bring you greetings from our President, Dr. William Ruto. Mmepokea? He has just left the country for some international engagement to Addis Ababa on matters to do with the African Union, and he has told me to tell you Happy Valentine. And he is very happy with the job that you are doing, and he has told me to tell you he loves you. It is because of this outstanding performance that we have reached 2.7 million households since the President launched the Community Health Program in October last year. In under 4 months, we have touched lives of at least 13.5 million Kenyans, a 25% reach in personalized health service. Distinguished guests, ladies and gentlemen, and our volunteers, this is what I mean in a personalized service. With a simple CHP kit of blood pressure machine and a glucometer, 1.56 million Kenyans have been screened for diabetes from the comfort of their homes. Of this, 24,000 have been referred to health facilities for quick attention, something that could have been missed, leading to life-threatening situations and complications. On the other hand, over 1.1 million Kenyans have been screened for hypertension at home, of whom 50,000 have been referred to health facilities for further attention. In addition, 54,000 expectant mothers have been screened. At least 24,000 have been referred to health facilities. It is a pragmatic approach by the Ruto administration to achieving universal health coverage. For the first time in the history of Kenya, most Kenyans at the bottom of the socio-economic pyramid can see a health service provider in their homes. We are on course to delivering on universal health coverage as envisioned under the Kenya Kwanza plan. Distinguished guests, ladies and gentlemen, our volunteers, on our part, we are investing in strengthening community and facility-based primary health care, as promised under the healthcare pillar. This is because we know that primary health care is a people-centered approach for promotive, preventive, curative, and rehabilitative services. With early detection of diseases and other health conditions, Afya Nyumbani is putting our nation on the path to reducing the cycle of health-induced poverty. Further, studies have shown that for every 1 Kenya shilling invested in community health, we would realize the equivalent of 9.4 million Kenya shilling, 9.4 Kenya shillings in economic and societal benefits. We want to stop Kenyans from sinking into poverty because quality health care is unaffordable to low-income households in a country where only about 1 in 4 people have a health insurance cover. It is also estimated that our people are spending over 150 billion shillings in out-of-pocket treatment. Besides selling property, harambes of medical bills are a common day occurrence. Even as we speak here today, I know in your phones, you have a WhatsApp group to raise funds for medical bills. While the National Hospital Insurance Fund requires at least 500 Kenya shillings in monthly payments, defaulting and dormant accounts for almost half of the membership leaves low-income families a step away from abject poverty. It is for this reason that our administration is undertaking radical reforms through the Social Health Insurance Act 2023 and other related frameworks for all to access quality health care as required by the Constitution. Sorting out health issues has a direct positive implication on improving the lives and livelihoods of the people, especially at the grassroots. The national government has provided at least 107,000 community health promoters with kits, 110,000 smartphones for electronic data collection, among other requirements, as agreed during the intergovernmental summits of February and December 2023. We are headed in the right direction towards a healthy and wealthy nation. Distinguished guests, ladies and gentlemen, and our volunteers, as we release a stipend to the community health promoters, they are ready to make their contribution to a healthier and better Kenya. In this regard, we are calling on counties led by our county governors, to fulfill and sustain their side of the bargain. Indeed, quality health care is not a favor to the people of Kenya. It is a constitutional right which we must fulfill together. Kenyans care about quality, efficiency, and effective service delivery. This can only be realized when the two levels of government complement and collaborate. To foster and sustain the gains we are making, the national government will strive to timely disburse funds to the counties. In conclusion, I thank the counties and our partners who have worked with us in implementing the CHP program. On this note, I request our 47 counties to also ensure smooth implementation of the CHP program by committing resources. Asanteni sana. Great people, I don't want to overemphasize your critical role in the success of the universal health coverage program. You are a critical pillar in this intervention. And I want to tell you that you are the unsung heroes, because you have been working for many years. You have been working for many years without anybody thinking about you. This is the first government since independence that has gone out of its way to appreciate that we need to support you, albeit in a small way. What we are giving you is really very little, but the gesture itself is important. That the Ruto administration appreciates your sacrifice, your commitment to helping our people. I want to say, as I travel around the country, since time immemorial, I've been a member of parliament, I've been a leader in this country as deputy president. The community health promoters are part and parcel of the Kenyan nation. Wherever you go, where there are 10 people, they are there. Even today, we were with the president early in the morning in Nyeri. There was a big crowd. We found some promoters in a corner somewhere. From there, we went to a place called Karatina. We found them there. We came to Gatundu. We found them there. When you go to a funeral, you find them there. You go to a wedding, you find them there. You go to a harambe, they are there. These promoters are part and parcel of the Kenyan nation. And our government, by providing for this stipend, makes that recognition. We really appreciate you. And we know how critical you are in the success of the primary health care program. So I really want to urge you to continue with commitment, with diligence, continue sacrificing your time to help other human beings the way you have always done. And it's on that note, I want to send a passionate plea to our governors to very quickly also organize their part of the stipend, so that with the 2,500 from our government, from the national government, and their 2,500, the promoter has some 5,000 to take care of his family and do a few things. So we are going to give you your money in arrears for the time that you have worked. Yeah. And thanks to technology, there will be no voucher. There will be nobody you are going to talk to pay you quickly. Wewe pesa yako ninakumisha na simu yako. So hakuna, there is nobody hapo katikati. si ndio? Unajua kama ingekuwa ni voucher inaenda cash office, sijui account, sijui audit. Sasa yeah. And we want to appreciate our bankers, KCB, and our service providers, Safaricom, for that service. And it will be very, very efficient so that we can reflect the efficiency you have shown us. You have been very efficient. It's only prudent on our part to be equally efficient. And let me say, this program, it has taken us 1 year to put things together. I want to talk to this good gentleman of the fourth estate. Out ya magazeti wacha niwaongeleshe. I have seen you write many things about this administration. Oh, it has not met pledges, oh, commitments, nini, what? There is no child who is born and starts walking the following day. There is no child who is born and starts eating githeri the following day. Hiyo mtoto must crawl, ajue kuongea, nini, akuwe na meno ndio akule githeri. We were sworn in on the 15th of September, 13th of September, and we took 3 years to set up government and structures. It has taken us another 1 year to put our programs into place. This one for the community health promoters being one of them. The results now will be seen this year. Because we have 100,000 kids, we have the promoters with communication gadget, and now they are motivated. They are able to move from home to home. And I want to tell you, good people from the fourth estate, our health bill will come down. Being that the cost of preventing a disease is 9 times the cost of curing one. So by investing in this program, it may look expensive in the short run, but in the medium term and long term, by these promoters going to homes and helping our people to prevent going to hospital, we'll cut down the cost of treating Kenyans. And this is one program, you good gentlemen of the press, I want us to have a discussion with you December this year. I want you to move around and talk to people who have been attended to by this great army. You have seen, before we came in, we found our elderly population, their monthly stipends used to delay for 8-10 months. Since we came in, those arrears have been cleared, and today they are paid before the 30th of every month. When we came in, the cost of fertilizer was 7,000. Through prudent intervention and proper planning and sound economic policies, the cost of fertilizer today is 2,500. As a result of having sustainable interventions, because the previous administration was subsidizing consumption, which is not sustainable, we decided to subsidize production. As a result of that intervention, within 1 year, this government, led by President William Ruto, has brought down the cost of unga from 230 shillings to 135 shillings in 1 year. Good people of the press, the dollar had gone to a skyrocketing price of 162. Today, as we speak, through prudent and effective interventions at the microeconomic levels, today the shilling is stabilizing every day And those who had hoarded dollars stand to lose a lot. I want to repeat, all those who are holding dollars, please rush to your next bureau or bank and cash them in. We had 1 year to reorganize our debt portfolio. When we came in, we found a debt of 9.6 trillion. Interest rates were going almost to 20%. 1 year of good planning. Today, all our debts are on course. We have met our obligations to the lenders, and you are aware that the Eurobond that is coming in June has been taken care of, and the future looks very bright. And I want to assure the people of Kenya that the planning stage now is over, and 2024, this is a year. This is a year. And I want to assure the people of this great country that they will start feeling, they have already started feeling, the effects of good economic planning and management. We have a president who is committed, with a team that backs him up, and you'll start now appreciating the benefits of that good planning. So we want you, good people of the press, at the end of this year, let's have a conversation on all the issues you have been raising. All the issues you have been raising. Some of you have been saying the president is traveling too much. The results of that travel are there for everybody to see. The president was not a tourist. He was going out to engage our partners, to negotiate loans, to negotiate economic interventions, to look for direct foreign investment. And the results are there for everybody to see. So I want to say, our great army, I wish you well. You are great people. Please continue being patriotic and supporting your country. Be merciful to those who are in need. Continue exercising care. Continue handling our patients with care and dignity because of the position that has been bestowed on you to help others. It is good to help others. It's godly and it's very fulfilling. For our members of parliament, we want to say thank you very much, Dr. Pukose and your committee, and indeed the entire National Assembly and the Senate, for the role you played in laws to anchor our health plan. We are very grateful. And we don't take the input of Parliament for granted. We are very, very, very grateful. I want to say, when I'm here as I conclude, that the President and I has total confidence in the leadership of CS Susan Nakumisha and her 2 PSs and the entire team in the Ministry of Health for the good job you are doing. Please continue. Mukanyangie hapo. You are doing a great job, and the President and I are very pleased with what is going on in the ministry. You have the support of the President. You have my support. Please continue leading from the front so that we can achieve universal health coverage, so that we stop these harambes over the weekends. There are too many. So that our people do not suffer in pain. Kwa hivyo mimi nimeshukuru sana, 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 na nimefurahi sana, na mimi natakia nyinyi mema mkiendelea na kazi yenu. Sisi yetu tumefanya, magavana wafanye yao, mupokee kitu yenu muende kazi. Si ndio? Si ndio? Na mkiona magavana wanakaakaa, mnawakumbusha. Si ndio? Unaambia President William Ruto na Rigiji na Susan wamefanya kazi yao. Na nyinyi mfanye si iko namna hiyo? Kila mtu asukume laini yake. Sisi tumesukuma yetu, sisi hatuna maneno na nyinyi, labda nyinyi mkuwe na maneno na sisi. Na unajua rais ni mtu ya kusema na kufanya nini? Na kutenda. Our president is focused. When he focuses on something, he doesn't look sideways. Mimi ndio naangalia kando kando, mtu asimchenge. Ninaambia wewe mkubwa, wewe angalia mbele, mimi naangalia kando na kando na nyuma. Unajua kuna watu wengine si wazuri sana. Akiangalia mbele wanaweza kuja na shoka. Sasa mimi niko hapo nyuma. Si mnaniona nakaa hapo nyuma? Na unaona nikikaa nikiangalia na mna ina nyuma. Si ati kwa sababu nimekosa kazi ya kufanya. Mimi nachunga mdoso asikuje kutatizwa na mtu yeyote. And him we can focus for this country, for the great people of Kenya. Asanteni sana. May God bless you and bless you abundantly.
Naam, asante sana. Makofi mazuri kwa Mheshimiwa Naibu Rais. Tukikuomba Mheshimiwa Naibu Rais kubaki mahali pale tunapomuomba pia waziri, makatibu wa kudumu, vile vile viongozi wetu kwenye bunge la Seneti na lile la kitaifa kujiunga na Mheshimiwa Naibu Rais pale kwenye jukwaa, washirika wenza wetu, our development partners, a kind request to join His Excellency the Deputy President on stage, right here on this table, and the next table, please. Wahudumu wetu wa afya, basi tumefikia mahali ambapo sote tulikuwa tumengoja. Mambo ni leo, mambo ni sasa. Tuko tayari? Tuko tayari? Aha, tuko tayari. Sijui kama mko na simu zenyu mkononi. Zipo? Manake mambo ni sasa hivi. Benki ya KCB wako hapa. Shirika la mawasiliano la Safaricom liko hapa, mko tayari? Sasa Mheshimiwa Naibu Rais akiwa pamoja na CS wetu wa afya, vile vile tunaye Bi Salome Mbogwa, Abdullahi Ahmed wakiwasilisha wahudumu. Kwa runinga yetu kwanza tutaona countdown. Runinga tafadhali countdown kabla tujabonyeza. 5 4 3 2 1. Basi tubonyeze. Shangwe jamani wahudumu, hatuwasikii. Benki ya KCB tuambie kama wamepata malipo. Sijui wahudumu walio karibu kama wamepata. Kuna wale ambao wako hapa mbele wangeweza kutuonyesha kama mambo ni mbashara, mambo inaweza kupatikana. Asanteni sana. Naam, asanti. Wahudumu, tumepata pesa zetu kwenye simu zetu. Tumepata kitu. Asanti. Basi tukiwa pale kidogo, Mheshimiwa Naibu Rais akiwasalimia wahudumu wa afya. Mhudumu atakuwa anatembea moja kwa moja akiwasalimia wahudumu hawa wa afya. Wahudumu tunawapenda na kuwaenzi. Wahudumu wanaofanya kazi kuhakikisha kwamba tumepata afya msingi pale nyumbani. Maanake tunasema afya yetu jukumu letu. Afya yetu jukumu letu. Sote tukiangalia simu zetu kuona kama tumepata kitu, kwani serikali ya kitaifa inahakikisha kwamba tunapata malipo haya.